Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments, such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org. I'm Gemma Gaudette, the host of Idaho Matters. We'll be taking you to all Idaho's 44 counties this year, like when we heard about the 125th anniversary of the Women's Century Club in Canyon County.
It's just been such a tradition of community support and wonderful things, and 125 is spectacular.
Who should we talk to in your county? Send us your ideas to Idaho Matters at boisestate.edu and tune in each weekday at noon and 8 for Idaho Matters. From the studios of Boise State Public Radio News, I'm Gemma Gaudette. You're listening to Idaho Matters. It's Friday, which means it's time for our Reporter Roundtable. This is when we get you updated on the news that made headlines this last week. And today, our panel includes Sarah Cutler, reporter with the Idaho Statesman, Drew Dodson, reporter and editor for the Valley Lookout, and Kyle Fonenstiel, reporter for the Idaho Capital Sun. Welcome, everybody. Happy Friday.
Happy Friday.
So I want to start today, if we can, with the Idaho Attorney General's office cutting paid paternal leave for new parents from 8 weeks to just 2. Now, this is a move that sets it apart from other state agencies, and it comes as Idaho is facing projected budget shortfalls. So Kyle and Sarah, I know both of you have been digging into this. You've both written about it. So Kyle, let me begin with you. What prompted this change now, and how significant are the budget shortfalls that the Attorney General's office says it's anticipating? And I mean, do we know how many employees this change could impact?
Yeah, so just to unpack things, I'll back up to 2020. That's when the AG's office adopted this policy change. It came after the governor issued an executive order to expand parental leave, but it's worth addressing that Idaho has a mix of different executive branch agencies that are handled by different constitutional offices. So the governor's office manages a big set of state government offices, but the AG's office is managed independently by an elected official, the attorney general, who's elected on his own ticket on the ballot. So the AG's office told me that this policy change wasn't mandated by the legislature and that it was a discretionary executive policy. So in terms of budget shortfalls, I don't have the specifics for how much the Attorney General's office is expecting, but on the statewide level, we're facing budget shortfalls that are projected. They could change to the tune of roughly $40 million this fiscal year, and then that's going to grow to around $500 million next fiscal year. As for the impact of this policy change, I don't really know yet. The AG's office didn't get back to me on if they made this decision because of the governor's order for budget holdbacks or how much this change would cost.
Okay, so Sarah, let me bring you into the conversation then. Since, as Kyle noted, this is specific to the AG's office, how does this decision then compare to parental leave policies in other independently elected statewide offices in Idaho?
Yeah, this wasn't something I had gotten a ton of information on. My impression, as far as I know, is that the AG's office is the only office that has made a change like this so far. My understanding, as Kyle said, these independently elected offices are not bound by, I guess you could say, executive orders, but my understanding is that they often basically choose to comply with these orders sort of out of goodwill. So my impression is that others are in alignment with the executive order, and this is the first change of this kind.
So does that mean, Sarah, that we could see this change happening at other statewide offices as well, or do we even know that yet?
I think that's a possibility for any office that is not, beholden to the governor's, that's not under the control of the governor. So one example, I believe, is the Secretary of State's office is another that is, independently run, not bound by these orders. But too soon to say. I haven't seen necessarily an appetite for that, but theoretically, I think it's possible.
Okay, so Kyle, what reaction, if any, has there been from staff within the Attorney General's office, or maybe from any employee advocacy groups?
I I don't know yet. I haven't seen anything official in terms of press releases, or I haven't been talked to by staff within the AG's office. But it's worth noting that a copy of this email announcement from the AG's office was posted earlier this week on Reddit and it's generating quite a bit of talk there.
Hmm. And Sarah, could the legislature or the governor take action to standardize parental leave policies across all state offices? Because I think it's worth noting that, I mean, going from 8 weeks to 2 weeks, I mean, 8 weeks is nothing, hardly. I mean, 2 weeks, I mean, if you have a C-section, which I had two, you're in the hospital for at least 5 days after childbirth, right? You can't, you have medical orders to not lift anything above 10 pounds for 6 weeks. I mean, there are medical restrictions on you. And I mean, I'm speaking now not as a journalist, I'm speaking as a parent, as a mother. This is something where, frankly, it's shocking in this day and age, frankly, in the United States of America, when we see just the lack of parental leave that we have in this country, and then to have it go down to just 2 weeks. And I understand the budget shortfalls, and I understand that, yes, the state is facing this, but can the legislature, will the governor do anything to standardize that? Or, moving forward, I mean, are we going to potentially see, at least in statewide offices, really a 2 weeks of parental leave potentially?
So, I think the governor's executive order in 2020 was obviously an effort to do some of that standardizing. I'm forgetting when that order will expire, but certainly could be renewed. However, that wouldn't, as we were discussing, that wouldn't necessarily affect this particular case, given that the AG's office is not really bound by that. However, the general counsel of the AG's office, who responded in a statement to some of my questions, did flag that part of the reason this change was happening is that this the 8-week leave policy was a discretionary executive order and not a binding legislative mandate, which certainly, raises the question of whether the legislature could pass something more binding. Again, it'll be interesting to see if this becomes a topic of discussion this session. I don't know that I've previously heard any appetite to pass that kind of legislation, but I think that's the kind of thing that would be needed to have a really uniform policy.
Hmm. Well, with that said, I mean, the legislature goes back into session Monday, so we all will wait and see what happens. Drew, let's shift gears here and head up to Valley County. You were on the show before the end of the year, and you talked about a man who was suspected of shooting his wife in Donnelly. In fact, I mean, this is close to where you live, you said. And we're finding out there's more to the story. But before we get to that, quickly remind us of what happened.
Yeah, so this was an incident that happened on the night of December 9th, and basically it sounds like there was some sort of argument that broke out and resulted in this man, Jose Mendoza, purportedly shooting his wife and then fleeing the scene. It was at a house right here in downtown Donnelly, which is almost an oxymoron, I know, downtown Donnelly. Uh, but just a couple hundred feet from where I live, and after the shooting, he fled the scene and was driving south on 55 before his truck slid off near the Rainbow Bridge, at which point he began walking south along the highway until a Good Samaritan picked him up. And then at some point during that car ride down to the Treasure Valley, the Good Samaritan overheard Mendoza describing in Spanish on a phone call kind of what had just happened in Donnelly and expressing a need to get to Mexico. And then shortly after they arrived there in Eagle, Mendoza was arrested without incident, and that was where we were last time I was on the show.
Okay, so let's fast forward to now, because that suspect is also wanted on federal immigration charges. So talk to us about this. What new information did the public records request reveal about Jose Mendoza's immigration status that wasn't previously known?
Yeah, so when this initially all went down, we knew that there was a federal hold on Mendoza. We didn't know what for. It could have been any number of different federal crimes. It could have been drug trafficking. It could have been some sort of tax charges, obviously immigration being one. So now with this, with the documentation that I was able to get from the Ada County Sheriff's Office, which was the arresting agency in this case, we know that it was immigration, and it doesn't speak to exactly what element of immigration law. It says it either lacks immigration status or is removable under U.S. immigration law. And typically, what that means is sometimes immigrants are subject to deportation if convicted of certain crimes while here in the States. This is a little bit of speculation. I don't believe that's the case with Mendoza. During a recent court hearing, the deputy prosecutor here in Valley County noted that Mendoza does not have much of a criminal history. He did have one previous conviction for a DUI a couple years back in Las Vegas, but the deputy prosecutor was not aware of any other criminal charges. Um, so that's what we know at that point about what that federal hold was for.
Hmm. So, Drew, do we know how this hold would impact his criminal case and his custody status, like in Valley County?
Yeah, so this is kind of interesting. When the federal hold initially, and that was kind of part of this case in the beginning, I just kind of assumed that would take precedence. But in fact, the court case here in Valley County will play out. And if a conviction is achieved, Mendoza would have to serve whatever sentence is handed down by the court. I can tell you right now he's facing up to 15 years in prison and $50,000 in fines. All of that would be resolved before the immigration authorities would take custody.
Hmm.
And so basically what that federal hold means is at the point that Mendoza would be released from local custody, local officials will hold him for 48 hours to allow federal authorities to take custody.
And Drew, before we wrap up, do we know anything about the condition of his wife following this shooting, and if there have any additional charges been considered or?
Well, we know a little bit. We don't know a lot. I had received a report in the days following the shooting that she was in a Boise area hospital recovering. She kind of had a gunshot wound to the shoulder neck area. I had received a report that she was stable. That's the most recent report I've received. However, I did talk to the sheriff earlier this week, and he noted that he also has not received an updated report, but he also has not received any notice from the hospitals to upgrade charges. That is, it would if she were to pass away in the hospital from these wounds, obviously the case would escalate to murder as opposed to aggravated assault, which is how it currently stands. So based on that, we can make a pretty safe assumption, but as far as, how is she today specifically? No, we don't know.
So, Kyle, can you talk to us about why two Idaho lawmakers want the state to pause, I believe it's $14 million in federal child care funds? So, my understanding is that this has something to do with some allegations in Minnesota. So, can we break this down and start with what happened very briefly in Minnesota to get these two lawmakers to want to stop this funding?
Yeah, so this is a complicated timeline. So as I'm sure many folks have heard about, there's uh, there's been a lot of chatter about fraud in Minnesota Medicaid programs and child care
Mm-hmm.
programs. This is stemming from this conservative social media influencer posted a YouTube video last month that went viral that alleged fraud in child care programs in Minnesota. That he had claimed that that daycare centers ran by Somalis were getting funds for childcare, but they weren't actually any children attending those centers. So
Mm.
this video, it's not clear how much of it has been corroborated or confirmed. Any of these allegations, it did prompt a pretty swift crackdown from the Trump administration on childcare funding. The U.S. Department of Health and Human Services said they were going to freeze child care payments to Minnesota, and they were going to require all states to justify that federal child care funds they receive are actually spent on what they call legitimate providers to get those dollars. So, so fast forwarding to what happened in Idaho, there are two Republican lawmakers, Senator Brian Lenny, he's from Nampa, and Representative Josh Tanner, he's from Eagle, and he's now going to be the co-chair of the legislature's powerful budget committee. They sent a letter to the Idaho Department of Health and Welfare asking the state to pause giving out Idaho's funds for child care.
Mm-hmm.
They say it's similar to Minnesota, and they say they want this pause in place until we put more safeguard measures in place.
Okay, so Kyle, my question is this.
Oh, sorry.
No, that's okay. I just want to ask you this then. Is there any evidence or allegations of fraud within Idaho's child care program, or is this request, purely preventative?
I have not seen any allegations of fraud in Idaho's program. We talked to Health and Welfare shortly after this letter came out, and they said that these funds haven't even gone out yet to providers. And it does sound like this is the preventative measure, just making sure there are safeguard measures in place. And Health and Welfare says they're shoring up safeguard measures and trying to make sure all the checks and balances are in place.
So if these funds are frozen, how could those funds, by freezing them, affect childcare providers and families who frankly are already facing limited availability and rising costs when it comes to childcare?
I guess first off, it's not entirely clear yet because these funds haven't gone out yet. We don't know the specific programs, the specific childcare centers that were going to receive these funds, where in the state they are. But it's no secret that Idaho has a tough childcare market. The legislature approved this funding. It was $14 million, all from the federal government, to expand childcare access in the state.
So at this point, Kyle, are there specific oversight or fraud prevention measures that the lawmakers are wanting before these funds should be sent out?
Yeah, they asked for a few things. I'll run through a quick list. They asked for the health department to make a comprehensive plan to prevent fraud and for enforcement. That plan should address verifying enrollment, financial transparency, the inspection protocols for childcare providers, and any coordination with the Attorney General's office. And they asked the department to look into any past payments for grants and subsidies, to look into any potential fraud, misuse, or noncompliance. And they asked the department to brief the legislature about this issue, including if there should be any changes to rules or laws. But it's also worth noting that the legislative leadership and the governor did a press conference yesterday previewing the legislative session, and a reporter asked about this. And the governor talked about how historically public assistance programs in Idaho have a pretty low fraud level. I've reported a lot on how Idaho has one of the lowest SNAP payment error rates in the nation. Those are payments that were done in a wrong way, and we have one of the lowest in the nation. And I can't remember the state's Medicaid payment error rate off the top of my head, but that was what the governor was saying in response to questions about this letter.
So, Kyle, even though these two lawmakers have asked for this, so is there going to be a pause? B, how much discretion does the Idaho Department of Health and Welfare have to ignore or comply with this request?
I don't know if there's officially going to be a pause. Health and Welfare says we're making sure all the safeguards are in place now, and we're shoring up efforts now. We're putting a lot of efforts into that. But in terms of how much discretion the health department has to respond to this request, that's a pretty complicated question. Health and Welfare is an executive branch agency managed by the governor, but at the same time, the legislature sets the agency's budget. So last year, we saw the legislature put strings on agencies' funding and budget bills. They did this through what we call intent language. That was basically telling the agency they have to do certain things to be able to spend money. And again, one of the two lawmakers who wrote this letter to Health and Welfare is now the co-chair of the budget setting committee. I don't know where we go from here, but we'll hopefully learn more as the legislative session gets in swing.
So, Kyle, I know you have to leave us a little bit early today. So, before you hop off with us, I wanted to talk about one other story that you've been covering. So we know that there have been numerous measles outbreaks in 2025. We are 9 days into 2026. We have our first reported case here in Idaho, and it happened in East Idaho. So, where are we in terms of what health officials in East Idaho are estimating on how many people may have been exposed? Because because I believe the child was unvaccinated, correct?
Yes, the child was unvaccinated. I haven't seen official estimates for how many people were exposed. They said that the local hospital is contacting people who were potentially exposed to educate them about the disease, and but the local health district there, Eastern Idaho Public Health, says they're not going to issue press releases updating the public about any other measles cases from within the child's household. But in a hopeful note, officials say they believe the child got measles when they were traveling out of state to an area that had an active outbreak. So they don't believe they got measles in Eastern Idaho.
Okay, I mean that is good to know. So with that though, my understanding, Kyle, is that the child, of course, needed some treatment, and they went to the local hospital. So is Eastern Idaho Public Health, what are they doing, I guess, in terms of, preventing further spread? I mean, letting other folks know who are at the hospital at the same time that this child was. Do we know what kind of steps they're taking in regards to that?
Yeah, so officials say that the local hospital, Madison Health and Rexburg, they're contacting folks who were potentially exposed, and I haven't seen much guidance from state and local officials beyond that. But again, on measles, officials have routinely stressed that vaccines are the best way to prevent measles. It's a rare disease, but it's super contagious and can be worse in young children and older people. All measles cases in Idaho last year were in kids who weren't vaccinated or they had unclear vaccine records.
Mhm. So Kyle, before we wrap this up, are health officials concerned at all that this case could signal broader vaccination gaps, maybe or increased risk of additional measles cases? Because Idaho has, if not the lowest, one of the lowest vaccination rates just across the board with vaccines in the country. So we shouldn't be that surprised if we see a case of the measles.
I haven't seen much talk from officials about this case in particular. This is the state's first measles case this year, and it comes on the heel of the country's worst outbreak of measles in decades. Idaho had 13 confirmed cases last year. And if you want to track measles in your area in Idaho, you can go to the Department of Health and Welfare's online dashboard for infectious disease reports. We link to that in our story about Idaho's first measles case this year.
Okay, well, appreciate that, Kyle, and thanks for coming on today. I know you've got a busy day ahead, so thanks for taking time for us.
Thanks, Gemma. Take care.
So, Sarah, as Idaho faces a projected budget deficit of hundreds of millions of dollars, the governor, as well as legislative leaders, are signaling some pretty sharp disagreements over Medicaid as well as tax cuts and how, or I guess whether, to reduce state spending in the upcoming legislative session. So, can you talk to us about why has Medicaid expansion become the central flashpoint in these budget discussions?
Yeah, I think there's a couple reasons for this. So the first is speaking recently with Representative Josh Tanner, who was appointed recently to co-chair the legislature's Powerful Finance Committee. I got a sense that a big part of the focus on Medicaid expansion is that lawmakers feel it's one of relatively few areas where they may even have the ability to make cuts, that there are a decent number of areas where they feel their hands are tied in terms of services the state must provide. I also would say, I think in terms of, why it's a flashpoint, I think there's a lot of frustration on the right that when Medicaid expansion passed, lawmakers were misled, I think is the sentiment I'm hearing, about how much it would cost. So the federal government covers 90% of the costs of expansion, but the state's annual share, that other 10%, was originally projected to be about 30 million, I believe. But by fiscal year 2026 was projected over 100 million. So those costs have gone up. And I'll say that there's a lot of disagreement between the left and the right about why that's happening. On the right, we hear a lot about fraud and the idea that folks are gaming the system to keep accessing this program. Though I will say I at least have mostly heard anecdotal evidence to support this. I haven't really seen a lot of data. And on the left, we hear more about the idea that just healthcare costs nationwide are rising and Medicaid is not immune to that. And so I think there's some disagreement that contributes to the frustration here about why we're seeing these costs spiking.
So, with that said, how firm is the governor's stance then against repealing Medicaid expansion? And would he ultimately veto a repeal bill if it reached his desk?
So I can say that yesterday, when a reporter asked him if he was open to repealing the program, he pretty bluntly and immediately said no. He even made a joke about giving one-word answers. However, when pressed a little bit and asked if he would veto a bill, he said he didn't want to commit to that, that he prefers not to commit to vetoes until he's actually, seen the details of proposals on his desk. But he really sounded the alarm about there being a lot of unintended consequences of cutting the program. And in the past, he has been outspoken about the importance of remembering that Medicaid expansion passed on a ballot initiative with, I think 60% of the vote. So it's very popular among Idahoans, and I think he's very aware of that.
So, what options seem most likely then to advance this session, Sarah? I mean, would it be spending cuts? I mean, would it be tapping rainy day funds? And maybe potentially reversing tax cuts? Or are we looking at a combination of both? Or do we just not know?
We definitely don't know. I think
Don't
in
know,
terms of
yeah.
predictions, in terms of predictions, I think we'll probably see a combination of the first two things you mentioned. So cuts to state programs, and then perhaps tapping into the state's rainy day funds. That's something that the governor and his staff have started to imply maybe on the table this year in ways that I think it hasn't been in recent years. I personally would be pretty shocked to see any kind of reversal of last year's tax cuts. That's something I've really only heard Democrats talk about or advocate for, and obviously they're a very small minority. And in fact, yesterday, the governor said he wouldn't be surprised to see proposals for even more tax cuts come across his desk this year. He didn't provide a lot of details or say how he would, would he veto, would he move that forward? But yeah, I think seeing a reversal of past tax cuts would be pretty surprising.
So, how could these budget decisions impact everyday Idahoans, Sarah? I mean, I think this is really the bottom line of it, right? Because we just talked about Medicaid expansion and whether that could be or will be looked at to be repealed, right? I mean, are they going to look at cutting more education funding? We even had the Sheriff's Association come out at the end of the year, urging the governor to not cut more because it goes into state services, right? We're talking about emergency management. So there are, potential significant impacts to the average citizen in however this unfolds.
Definitely. I can say yesterday, Democratic leaders, the House and Senate minority leaders were talking about the fact that they are actually already being deluged with phone calls from Idahoans about the impact of 3% budget cuts that Governor Little ordered back in, I think it was August, as budget issues were starting to come to light. So some of those kind of initial cuts that have been made, we're already seeing the effects. And I think that what I've heard a lot about there relates to healthcare. That, the state health department has, for example, cut back the amount that it reimburses for Medicaid. And this is, with healthcare providers who were already stretched pretty thin. I think there are some concerns that some providers may simply stop accepting patients who have Medicaid as their insurance. And of course, at the same time, I won't go off on a tangent, but we've got changes at the national level making Affordable Care Act marketplace health insurance plans more expensive. So I think there's a lot of concerns, especially in the healthcare space, about state and federal cuts maybe exacerbating one another. I'll touch quickly on education since you mentioned that as well. We did hear yesterday that the governor say that his proposed budget, which we'll hear more about that on Monday, but it protects spending for K through 12 education. Sounds like it's a bit of a close call, but we know that that's been a priority for him. I think we also heard from senior lawmakers on the right that that remains a priority. So I think folks want to keep funding there. I think healthcare may be where we see more of an open question.
Mhm. So, Drew, let's talk about avalanches because Valley County is weighing some avalanche related closures on Warm Lake Road. Then there was a landslide, right? That cut off another key route, and this may complicate some decisions about access this winter. So, can we begin by how severe is that landslide on South Fork Road? Because I believe you went out to it last night, and I mean, will this completely cut off winter vehicle access to Yellow Pine?
Yeah, so at this point, I drove out there last night and I could only get like within a mile of the landslide itself. So I didn't get my own eyes on it, but I've seen pictures and judging from the pictures, I haven't gotten anything official on this. It appears to be about maybe 20 feet in terms of length of roadway, and it kind of slid off, maybe a couple feet into the roadway. Um, so not the biggest landslide you've ever seen, but also not nothing. And I think
Hmm.
probably the most important thing to realize here with this specifically is that South Fork Road is a one-lane road. It's a 30-mile length road from Warm Lake Road right there by Warm Lake is where the turnoff is, and then it runs north-south up to Lick Creek Road, if you're familiar with that one. And it just
Hmm.
follows the South Fork Salmon River drainage, and it's a paved route. It's the traditional wintertime access for cars to Yellow Pine. It's plowed by Valley County. But yeah, any sort of loss of roadway due to landslide on a one lane road, there's just there's not a ton of margin for error as it
Yeah.
is, and so losing that, it at this point, it has been closed by the Forest Service. We don't have a timeline for repairs. But certainly for right now, the only way to get to Yellow Pine by car is over Warm Lake Summit, which I think we've talked about on previous shows is its own matter right now as far as what that's going to look like this winter.
Yeah, so let's talk a little bit more about this for folks who aren't familiar and why this landslide is frankly such a big deal. As you said, Warm Lake Road is the only way to now get to Yellow Pine. But Valley County is looking at putting what restrictions in place, right, over Warm Lake Summit because of potential avalanche issues. So where does that stand right now in terms of the fact that this is the only way you can get in and out of Yellow Pine? I mean, at least by
Well,
car.
yeah, and it's kind of fortuitous the timing on this because, in any other year in recent history, South Fork Road was the only way to get to Yellow Pine by car because Warm Lake Road for decades beyond Warm Lake, so about I'm guessing on mileage here, but roughly 25 miles east of east of Idaho 55 has transitioned to groomed snowmobile route during the winter. Like I said, for decades it's been that way. It's only changed this year because Perpetua Resources, a Boise mining company, they have been approved by the Forest Service to operate a gold and antimony mine up at Stibnite, which is in the vicinity of Yellow Pine. And so, because of that, they're plowing Warm Lake Road up over Warm Lake Summit to provide continued access to the site. So if this was any other year, the vehicular access would be off the table already 100%. Now what we're really talking about and what the county is trying to work through almost as we speak is okay, so the road over Warm Lake Summit is plowed for this year. What are we going to do about public access? Is it going to be willy-nilly? People can come and go as they please? Are we going to put up gates? Are we going to have certain time periods of closures? That's what's all being worked out right now. Um, Before this landslide, that was kind of a different conversation, right? Because there was
Hmm.
always the workaround route, the primary route via South Fork Road. Now, you've got about roughly 25, 35 year-round residents who live in Yellow Pine and who rely on those roads being open to come to town for groceries, fuel, things of that nature. Um, and so it's an interesting conundrum.
To say the least, right? So I'm assuming, Drew, that county officials are maybe potentially making an urgent plan about this.
Well, I'll be honest, I haven't heard much from the county at this stage in the game. I think everybody involved here is trying to kind of get their arms around it,
Hmm.
and see where things go. I can tell you that regardless of the landslide and the South Fork Road closure, this was on the county commissioner's agenda for Monday, this discussion about, what we're going to do about public access over Warm Lake Summit. So this kind of just adds another wrinkle to an already urgent conversation. I know county officials have not felt particularly warm and fuzzy that, we're approaching mid-January and we don't have a firm plan for what public access over Warm Lake Summit is going to look like over this winter. The primary concern is certainly avalanche danger. I drove the pass yesterday, and certainly you can see that there's some places where, yeah, if you got 18 inches, 2 feet of snow all of a sudden, yeah, it might come down over the roadway. Um,
Mm.
so I don't know that the conversation could be much more urgent than it already was, but certainly this adds another layer to it.
So, Sarah, Idaho lawmakers are pushing back against a federal move to loosen marijuana restrictions. So, my question is this: how likely is it that our state's legislature will take concrete action in response to the federal rescheduling of marijuana, and they're rescheduling the class of drug that marijuana is?
That's right. They're kind of downgrading the schedule to show it as lower risk and something where there's more room for potentially medical testing or experimentation. And as you alluded to, Idaho lawmakers have been really outspoken against marijuana, really hard on drugs over the years, so they're not happy about the rescheduling. But perhaps surprisingly, I'm actually hearing that they probably won't take any immediate action in response, at least this session. And that's partially because President Trump's executive order isn't something that actually immediately takes effect. It's more signaling than anything else. Senator Scott Grow framed it as like a shot across the bow in terms of signaling intent. And the other reason is that lawmakers actually in the 2025 session passed a bill to put on the ballot in November an amendment to the state's constitution that would make it harder for ballot initiatives related to drugs to pass. So this session, they might be kind of on pause, waiting to see what ends up happening with that amendment.
Okay, so tell us a little bit more about this proposed amendment, because as you said, it's going to be on the ballot in November. And is it basic? My understanding is, so correct me if I'm wrong, is it's basically asking voters to say, do you want to be able to, say if something can be legal or not when it comes to drugs, or you're going to let legislators make that decision for you?
Right. So on most issues, we have a possibility or we have a possibility in the state of this ballot initiative process where if something gets enough signatures, the proposal can make it onto the ballot and voters can kind of decide for themselves. This proposed amendment would basically say on the topic of legalizing marijuana and other drugs, that's not an option. Only the legislature can make that decision. So it's kind of an effort to shut down the ballot initiative process on that topic. And ironically, could be on the ballot at the same time as one of those very initiatives, a campaign to legalize medical marijuana, which is,
Hmm.
as we speak, in the process of trying to rack up the signatures required to get on the ballot. So we could have two very much competing measures on the ballot in
Yeah.
November.
So, how influential, Sarah, could the medical marijuana campaign be expected? I mean, given questions around funding sources and public support, because let's be perfectly clear here. Um, yes, marijuana is federally illegal. It is legal in numerous states. I believe Idaho might be the last holdout. There are marijuana dispensaries in Ontario across the border. There is a lot of money that I'm sure is being funded by Idaho that is going to Oregon. So here we are in this huge budget deficit. And, I've heard rumblings that people are saying, we could make up this deficit if we allowed for this. I mean, granted, I don't see the state selling marijuana to fund, the budget deficit. So that argument might be moot. But with that said, again, what do you think this is going to look like moving forward with the campaign to try to either leave this in the hands of legislators or, as you said, try to get at least medical marijuana legalized in the state?
Yeah, I think, as you can imagine, some of that remains a bit of an open question. I was hearing from opponents of that initiative that they actually didn't even think the initiative would get the signatures required to make it onto the ballot, so they thought it would become kind of a moot point. I did talk with, or I emailed with, the spokesperson for the Natural Medicine Alliance of Idaho, which has kind of spearheaded this initiative, and she declined to share how many signatures they've gotten so far because they were still being certified, though she did tell me the campaign has very strong momentum. I will say it was interesting speaking with particularly opponents of the initiative. I think there was a lot of suspicion about where the funding is coming from, whether it's in state or out of state. And that was something that we could partially, but very much not fully track down through the Secretary of State's Sunshine website. Um, the spokesperson for Natural Medicine Alliance emphasized that this is a grassroots local campaign, but I think it's worth at least noting that in the conversation about this, there's a lot of suspicion and questioning about, is this something that's coming from within, an interest coming from within Idaho? Is this coming from out of state? And yeah, you raise, some good points about what this looks like given the availability of marijuana just across the border in Ontario. I've definitely heard mixed portrayals of whether that's, whether we would want to see something like Ontario in Idaho, or again, speaking with opponents of the initiative, I think they fear that Ontario is, overrun and not the kind of place that we would want to become. So definitely some diverging perspectives about what's going on there.
Yeah, absolutely. Well, thanks for that. So, Drew, a bit of some sad news for the annual sled dog race in Valley County as it's being canceled again due to lack of snow. I mean, how unusual is it for snow conditions to be this poor in early January in Valley County? I mean, for this race corridor in particular.
Well, it's fairly unusual. I mean, it's kind of, I don't know. I as a backcountry skier, as a big skier, it's the reason why I live here. I'm kind of torn on this because we do see these sorts of slow starts to winter from time to time. I think it happened like 2 years ago. Very similar situation. And then usually what happens is all of a sudden it comes fast and furious and you forget all about the slow start. Um,
Yeah.
that being said, this year has been pretty exceptional. This is not the first time that the sled dog challenge has had to cancel due to what I call low tide snow conditions. The same thing happened back in 2024. So it's not unprecedented, but it's not the norm either.
hmm So, Drew, I mean, what factors do organizers consider when they decide whether the shorter Warm Lake stage race can still safely move forward? Because will the shorter race at this point still move forward, or do we not know?
Well, we don't know at this point. The Warm Lake Stage Race, it's a 52-mile race compared to the other two races which have been canceled so far, the 100-mile race and then the 300-mile race, which is actually a qualifier for the Iditarod in Alaska. It really does come down to safety. I mean, the reason they pulled the plug on the longer races is, they were assessing trail conditions, and in some places, is pert near down to gravel, and
Mm,
you can't have dog sled teams running over that. And really, the bigger issue is, as I mentioned, this is an Iditarod qualifier. This is not something that it's just local Valley County residents competing in. People travel from all over the Western U.S. to come here and compete in hopes of making it to the Iditarod. And so, yeah, the race is a month away. Essentially, I think it was scheduled for like February 2nd, I think, starting right around that time frame. But if you're traveling from several states away, it's kind of tough
yeah.
to pin all your hopes on, well, maybe we'll get a whole bunch of snow sometime in the next
Yeah.
couple
And
weeks.
Drew, I'm going to have to cut you off. We are out of time. Thank you to all of our reporters. Have a great weekend, everyone. We'll be back Monday. And that'll do it for this episode of Idaho Matters. Thanks so much for listening. And just a reminder, you can find all of our episodes wherever you get your podcasts.
How does AI even work? Where does creativity come from? What's the secret to living longer? TED Radio Hour explores the biggest questions with some of the world's greatest thinkers. They will surprise, challenge, and even change you. Listen to NPR's TED Radio Hour wherever you get your podcasts.